News and views, issues and opportunities. We'll have in-depth conversations with decision makers to find out what they know and what they think. I'm Rico Hizon, inviting you to join the exchange because your business is our business. The choice between lives and livelihood is crucial in a time of survival.
Either you are in a lockdown or you are not in a lockdown.
As a raging COVID-19 breaks infection records day after day, while restrictions remain, businesses cautiously reopen and ready to test, trace, and treat if and when the virus strikes. A look into the costs and benefits of coronavirus screening and how this enables businesses to sustain small gains in a crisis situation. Building a digital trail to break the chain of virus transmission and a shot or two in the arm to shield against a global pandemic. The vision for a post-COVID-19 world in our C-Suite vision. The spike in coronavirus infections has derailed our reopening plans, and an effective contact tracing system is needed to safely sustain businesses under the new normal. Let's now have an exchange with the developers of contact tracing apps, David Almiron Jr. of Multisys Technologies, who is behind StaySafe.ph, and Hansi Narida of AppCase, which developed the integrated apps of Pasig, Mandaluyong, Valenzuela, Antipolo, and now Taytay. Gentlemen, thank you so much for joining us. Umpisan natin sa iyo, David, no? Sinabi ni Secretary Duque, ang contact tracing app ng StaySafe has almost no impact. Bakit hindi maka-take off ang StaySafe pag hinahawakan ng gobyerno?
Hi, Rico. Yes, I think, ewan ko kung saan nanggaling yon, pero it's all about implementation eh. Alam natin, Rico, no, kahit gaano kagandang isang sistema, kapag hindi masyadong na-implement, no, nagkakaroon talaga ng ng downfall. Kaya nung na-donate namin ng StaySafe sa DILG, ang isang inaasahan namin ay ma-activate lahat ng features ng StaySafe. So in fairness sa DILG, talagang they did their best naman to take over the donation. In a very short period of time, they were able to take over the system. Siguro ang kailangan lang talaga ay ma-maximize yung usage ni StaySafe. Kasi hindi lang digital logbook si StaySafe, kailangan nilang i-activate yung ibang mga features. Ang siguro din na humble suggestion namin, kung talagang kinakailangan na makatulong kami ulit, kung kailangan pa nilang tulong namin to activate all the features ng StaySafe, we're just here, Rico, kung kinakailangan kami bumalik at tumulong ulit sa implementasyon ng StaySafe. Pero currently, hindi nila na-maximize, hindi na-implement lahat ng features ng StaySafe.
Hansi, ikaw naman, AppCase developed the integrated contact tracing apps of 5 LGUs. What is the advantage of having several instead of a unified one like StaySafe.ph?
One reason is that may kanya-kanya kasing policy yung bawat local government unit. And along with this contact tracing tool kasi, that we provided them is also an ordinance. So for Valenzuela, for Pasig, they have a separate ordinance on how you actually maximize the use of this and force people to use it. So in the end, it takes actually the government in local government unit to impose a certain mandate and to use the contact tracing well. And for the case of Valtrace, Pasig Pass, they made it simple. One is that in using QR code kasi, it simplifies the process. It does not require you to have cell phone, data connection. So instead, you can reproduce the QR code and use it anywhere. So whenever you go to high-risk establishment, so like for example, malls, it becomes easier. So it goes down to people who cannot afford to buy a cell phone and scan this QR code, stick on outside this establishment.
So, David, paano natin ma-merge yung StaySafe.ph contact tracing at saka itong applications ni Hansi sa AppCase of the 5 LGUs? Pwede bang emerge eventually into having one contact tracing app nationally?
Actually, tama si na hindi kasi iba-iba yung policy at iba-iba minsan yung gusto ng mga LGU, no? They have their own ordinances. Pero meron kaming ginawa kasi na Stay Safe API. Matagal na namin ginawa yon, last year pa yon. Actually, ang nagpagawa sa amin noon yung guidance din ni Mayor Magalong. Maayos yung pagkakagawa namin ng API na yon. Hindi lang na-distribute sa lahat ng LGU. Kasi I don't agree na hindi na kahit maraming app yan basta may integration. Dalawa lang naman ang kailangan natin dito, Rico, yung implementasyon at yung enforcement, importante yon. Pangatlo, kailangan mag-integrate tayo. Yun yung matagal na naming inaasahan na mangyari nung na-donate namin ng ang Stay Safe sa government. I think kung mag-uusap lahat-lahat ang merong contact tracing, kapag nag-unify tayo ng integrations, API-based lang naman po yan, hindi po mahirap gawin So I think integration will be the key to make sure that itong mga effort ng lahat ng LGU, effort ng national government, effort ng private at effort ng LGU, mapag-unify natin through integration. It's not time to compete It's time to really, collaborate and unify.
Oo nga, para sa bayan nito, di ba, Hansi, no? Kasi nakikita natin, infections are rising, active cases are soaring to record highs. At saka, mahigit ng isang taon kalahati na wala pa tayong integrated contact tracing app. Kagaya ng ibang bansa, kung isa-isa lang. And di ba, kaya ba natin, Hansi?
Yeah, I think so, sir. In fact, we're gearing up with integrating with other providers, like Stay Safe. And in fact, I think I remember we have an API ready to connect to Stay Safe. Kaya lang, according dun sa Resolution 116 ni IATF, we're still waiting for the policy to be drafted by the ICT. So it's been, I think it was last May pa. So we've been waiting for several months na.
Oo. Ang importante talaga dito, magkaisa, pero the bureaucracy of the government and the different interests of various groups is hampering a unified contact tracing app, David.
Yes, actually, ang daming gumagamit We've seen a lot of success stories sa Stay Safe, no? Hindi lang kami masyado nagpa-publicly announce kung ano yung mga nasalba nating buhay. Kasi ang Stay Safe hindi lang naman siya logbook na which is claimed sa news. Hindi siya logbook Kasi yes, may logbook capability siya, pero ang maganda sa Stay Safe kasi, may capability kang i-inquire kung positive case yung pumapasok sa establishment mo. Imagine kung yun ang in-implement natin na pagpasok pa lang sa establishment, pagka-scan, alam mo na agad kung positive o hindi yung tao. Saka merong access sa core Ang problema lang, walang access yung maraming LGU. Kaya yung encouragement ni Mayor Magalong na sana mabigyan ng access lahat ng LGU sa Stay Safe core o yung ating tinatawag na admin panel para makapag-investigate sila ng mga na-contact in a specific location. Ang isa pa na napansin namin dito ay, dahil kanya-kanya yung integration na ginagawa, kailangan talagang may unified integration Which is nagawa na ni Stay Safe yun, like yung nabanggit kanina. Mahirap kasi na kung si Stay Safe ang mag-i-integrate isa-isa sa contact tracing. Dapat, si Stay Safe, which is the national contact tracing, dapat dito mag-integrate yung mga iba-ibang mga contact tracing para ma-unify. Or else, hindi naman po pwedeng isa-isahin ni Stay Safe na mag-integrate sa lahat ng contact tracing sa Pilipinas. In our list, meron kaming 37 na contact tracing na kumo-contact sa amin that time. Which is we cannot do that na isa-isa.
And definitely, we can save more lives with a unified contact tracing application. Maraming salamat for joining us on the exchange. David Almirol of Multisys Technologies and Hansi Narida of Appcase. And now here are the week's top business stories. The Philippines posted a budget deficit of more than 837 billion pesos from January to July. And this means government spending outpaced revenue collection during this period. The Trade Department and foreign businesses continue to call on lawmakers to immediately pass bills that would ease foreign direct investments restrictions. And these includes amendments to the retail trade liberalization, public service, and foreign investment laws that President Duterte has certified urgent. And the National Privacy Commission orders the immediate closure of 4 online lending apps. These are One Hand, Lemon Loan, Cash Jeep, and Peso Pop. These apps are under investigation for their alleged unauthorized and excessive use of borrowers' personal information. And we'll take this quick break on the exchange where your business is our business. Are millennials and Gen Zs saving and investing more? Find out how the pandemic has affected the saving habits of young people. And this fitness tracker tells you that it's okay to just relax and not work out. Keep it right here on CNN Philippines. News you can use, news you can trust. Glad you're staying with us right here on The Exchange, where your business is our business. I'm Rico Hizon. The coronavirus pandemic has made millennials and Generation Zs rethink their financial status and seek ways to grow their money. A survey conducted by Manulife shows that Filipinos aged 15 to 40 years old have become more financially conscious and during this health crisis. Among their preferred financial product types are insurance, bonds, and cryptocurrencies. In my interview with financial planner Salve Duplito on The Final Word, she said it is best to pay liabilities and build up an emergency fund first before shelling out hard-earned money for investments.
Prior to the pandemic, we always said 3 to 6 months is good enough. Kung may negosyo ka 6 months, kung meron kang salary 3 months, okay na. But the pandemic erased that. We see it's already 18 months. Dapat meron ka ng minimum of 10 months emergency funds before ka mag-invest para sigurado na kung magkaroon ka ng emergency, hindi ka mapapa-withdraw from the market ng palugi.
Well, Duplito stress, it is best to do some research on investments first because high rewards also involve high risks. COVID-19 tests are part and parcel of an effective blueprint to economic reopening, but our daily testing numbers remain low. It begs the question, how many people out there do not know that they are infected? Let's now have an exchange with Raul Destura of Manila Health Tech and Tomas Navasero of LabX. Gentlemen, thank you so much for joining us on The Exchange. Tom, umpisahan natin sa iyo, no? Usually mabigat ang antigen test, no? Sa bulsa ng ating mga kababayan, between 1,500 to 2,000 pesos per test. Paano ninyo ginagawang mas affordable ang antigen test para sa ating mga kababayan?
Well, first, let's state that the DOH just released a cap on antigen testing, which is basically sub 1,000 pesos. But what we've done in our development of the Xaria is a lower cost product. We've designed it here in BGC and manufactured in China. And now we can probably provide a test that is sub 100 pesos per test. And the key here is the cost is this testing of a nurse. You know, going to the test site is expensive. Having a nurse doing it is expensive. What we've done here is we've integrated Zoom and teletesting. This reduces the cost. At the same time, still provides the administration by a health professional. In the Philippines, self-testing is yet not allowed. And I hope one day soon, like the rest of the world, the FDA will amend its advisory to allow home use and self-testing sooner than later.
Okay, is this self-testing kit that you have, Tom, is it reliable? Is it advisable? Because a lot of people right now want to go to clinics to have themselves tested rather than do it themselves at home.
It's very reliable, Rico. The EU have ordered about 50 million the last 6 months. And our neighbor, Thailand, just 2 weeks ago, ordered 8 million of these tests. So there is demand out there for an accurate, affordable, and accessible test solution. And we hope we can empower the Filipinos also to do home testing so that if they were exposed, they can either do one test or a serial test of 2, 3, 5 days separated to ensure that they don't go out and spread that virus. Second, most importantly, is how can we win this pandemic if we cannot see the enemy? Testing, rapid testing allows us to see the virus so that we can win this pandemic.
Ikaw naman, Raul, no? Your group has developed its own RT-PCR swab test kit. Yung mga presyo sa hospital at Red Cross between 3,000 to 4,000 ang rates. How affordable are your RT-PCR test kits?
Currently, it's being a little bit above 1,000, 1,650 per test. We were able to lower down further the cost as the demand increases, and we were able to negotiate from those suppliers of raw materials to provide much better rates for us. In order for us to, every time we get a deduction from our suppliers, we translate it to the price of the test, because that was our commitment from the very beginning. And so far, we have supplied a lot of laboratories from Luzon, Visayas, and Mindanao, and providing also testing kits also to local government units. That allows us to expand further the reach of an affordable diagnostic kits that's a little bit a few hundred above the price of an antigen detection test. And the challenge here really is access, because it would require the diagnostic laboratories to run all of these processes.
Raul, I would like to jump in. No, sinusuporta ba ng gobyerno ang mga locally made kits?
Right now, it's being supported by the local government units and private sector. And we've been supplying them the technologies for over a year now, and it's continually increasing. The good thing about it is, because we have the capacity to innovate and revise and revisit, we can always monitor the diagnostic accuracy of the technology based on the circulating variants in the country. So any changes in that, we can rapidly adapt. But the good news is it can still pick up all of these variants that are circulating here in the Philippines.
Tom, let me ask you, you mentioned that your self-testing antigen kits are now being distributed overseas. But what about locally? How is the business doing so far? Are companies, local companies, businesses, LGUs availing of your services on a regular basis to test their employees and their constituents?
Yes, they are. They're finally realizing that testing at home, testing before going to work, and at work through a health professional can ease the pain, can ensure that the employees are safe and productive. So the key here is to keep that cost down, as Dr. Destura mentioned. We must ensure that we continue to keep the cost down per test. Our goal here, as we submitted to the WHO Find Act program, is to meet a sub $2 test. And testing is the expensive part, and that's why we integrated our solution with an AI symptoma platform for pre-assessment, and at the same time, we use Zoom to connect the nurse and the patient.
Thank you so much, gentlemen, for this COVID testing exchange. Raul Destura of Manila Health Tech and Tomas Navasero of LabX. And now here's the latest in tech. Fitbit will not just track your physical health, but also your mental health. The company says it will now keep tabs on your mental and physical readiness for the day. Your device will generate a score each morning to help you measure your body's responses to stress based on your activity level the previous day. Well, if your score is low, the device may suggest activities such as yoga, stretching, or a mindfulness session. And straight ahead on the exchange, where your business is our business, the government is planning to borrow billions of new loans to fund projects for economic recovery. And how can COVID-19 vaccines help us get back on track? We'll have an exchange with AstraZeneca's country president, Lotis Ramin. Keep it right here on CNN Philippines. News you can use, news you can trust. Welcome back to the exchange, where your business is our business. I'm Rico Hizon. Well, the government is on a borrowing spree to fund projects that would help the economy recover from the health crisis, according to proposals for the 2022 national budget. The Duterte administration plans to tap the Asian Development Bank, World Bank, Japan International Cooperation Agency, and two others for a total of 162.5 billion pesos in loans. And this would be used for universal health care, post-pandemic employment recovery, infrastructure spending, agriculture development, and disaster risk reduction. This week, the country secured a 140 billion peso special drawing rights from the International Monetary Fund for pandemic response. The government says Metro Manila is on track to achieve population protection by the end of the month, and that means almost 50% of eligible adults in the country's main economic hub are now fully immunized. Officials have recalibrated vaccination targets in a bid to revive jobs and resuscitate the ailing economy. Let's now have an exchange with AstraZeneca Philippines President Lotis Ramin. Lotis, thank you so much for joining us on the exchange. You know, a regular supply of AstraZeneca vaccines are indeed very important in making population protection and even herd immunity happen. How much more of the Astra doses will be arriving this year in the country?
So, Rico, thanks for having me. And I'm pleased to confirm that to date, more than 8 million doses of the AstraZeneca vaccine has already been delivered to the Philippines. This includes more than 1 million doses delivered this month. And we expect to deliver millions more, more than 14 million doses from now until early part of next year for the tripartite agreement. And should there be additional donations from COVAX or other nations, AstraZeneca will also support the delivery of those doses.
This is wonderful news, a steady supply of AstraZeneca vaccines for the country to be able to attain population protection and eventually herd immunity, Lotis. But of course, during this ongoing Delta variant, we're seeing more kids being infected. Lotis, how soon before the Astra vaccine can be administered on children?
Yeah, Rico, children are indeed also vulnerable to COVID-19. So it's understandable for parents to be concerned. While AstraZeneca vaccine does not have data to support the use in pediatric population, one way to protect our children is for more adults to get vaccinated and strictly follow health protocols, because adults remain to be the more susceptible population. And when it comes to this population, Rico, 18 years old and above, the AstraZeneca vaccine, based on our clinical studies, is able to show high levels of protection against multiple variants. It's highly effective and well tolerated.
All right, the likes of Pfizer, Moderna of the US already preparing booster shots. Is AstraZeneca also preparing one going forward?
So we continue to observe the data on durability, and we expect to see more data coming on effectiveness and durability. And we will, of course, share that with the public once available. Ultimately, Rico, decisions on booster dose strategy will have to be made by the Public Health Office. But what I can say is, with the current regimen that is approved in the country for 2 doses of the AstraZeneca vaccine, we're seeing that it offers high level of protection against multiple variants. So, in particular, the Delta variant, which is the variant of concern these days, as much as 92% reduction of severe disease and hospitalization.
And Lotis, you mentioned that 22 million doses of AstraZeneca involving tripartite deals and donations will be coming to the Philippines over the next several months. And this could be the first generation of orders. What about the second wave of procurement? Does this mean that LGUs and businesses will now be able to buy directly from you now?
So, Rico, right now, our main priority is to support the ongoing vaccination. And that means fulfilling our current agreements. The agreements that we have today is a tripartite agreement with the national government, the LGUs as well as the private sector. So that's the main priority. Now, of course, future procurement for future needs is something, a decision for the government to make. And while we fulfill our current commitment, we also look ahead to future supply agreements in 2022 and beyond. And we will work closely with the government to understand the future needs as well as the requirements, and of course closely work with all our stakeholders to support what the country needs to recover from this pandemic.
Lotis, you are the first Filipino president ever of AstraZeneca in the country, and also the first woman. How are you coping and adjusting to the pressures of work? I mean, from all sectors, asking you, when are we going to have our supplies? When will they be arriving? How are you adjusting to all of this?
When we started this journey, the mission was very clear. We want to help the world recover from this pandemic, and we want to make our vaccine a vaccine for the world. And true to that mission, Rico, more than 1 billion doses of the AstraZeneca vaccine today has been delivered to over 170 countries. And 2/3 of those countries are low and middle income countries. Then secondly, in the Philippines, as the pioneer of tripartite agreement, we actually saw the Filipino bayanihan spirit come to life with multiple stakeholders coming together. And ako as a Filipina, I'm truly proud of that and really showcase that. Pero ang pinaka-importante, Rico, is seeing finally the vaccines in the arms of people, knowing that lives are being saved, and preventing hundreds of thousands of hospitalizations. This keeps us going every day. And for this very reasons, we are committed to continue to, help the country fight this pandemic. And hopefully by working together, we can all achieve herd immunity.
Thank you so much for this management and vaccine exchange, AstraZeneca Country President Lotis Ramian. And this is the exchange who makes sense of the facts and the figures and the ups and downs of the business cycle, because your business is our business. I'm Rico Hizon. Thanks for watching CNN Philippines. News you can use. News you can trust.